Hello, everybody. Today we'll be speaking about flat foot and adults. That's the topic I've been asked to speak on, and we'll just get into it straight away. So flat foot in adults, I'll basically be talking about a new onset flat foot in adults, what exactly it means and what are the consequences and what do we need to do about it. We'll be talking about a bit about the biomechanics, because that is very important to understanding this concept. So if you see this, this patient here from the back, you see the heel, both the heels are in valgus. However, as soon as the patient gets up on tiptoes, the heels go back into varus. So on standing, the heel should be either neutral or about 5 degrees of valgus, not more than that. This is much more than that. So this is an excessive heel valgus. But as soon as a normal patient, stand on his tiptoes, the arch should normally form and the heel should go into varus. Now, once we see any flat foot, we have to first decide whether this is a flexible flat foot, a passively correctable flat foot, or a rigid flat foot. So flexible and rigid, we can understand. Flexible is when it can completely go back to a normal arch flat foot, foot-shaped foot, and not be a flat foot, especially when the patient stands on his tiptoes. A passively correctable one is in middle of between a rigid and a flexible, where it is the patient cannot actively make it the arch back with any movements. However, when the surgeon examines it, he can make the heel go back into neutral, and that is a passively correctable. And a rigid is when the surgeon himself cannot correct the deformity even with passive manipulation. So we'll just see what it exactly means. And so see this patient. So he's got excessive valgus when he's weight bearing, and as soon as he goes up, the heel you see goes into as there's nice arch form. So this is a flexible flat foot. And what does the heel going into varus means? That means two things. One is that the tibialis posterior tendon, which is the main muscle causing this action, is working well. The other thing it tells us is that the subtalar joint is flexible, and it's not a rigid subtalar joint. So that's the two things we can confirm immediately when we see this kind of presentation. However, if we see this here, if you see the left side, you see that the heel stays into valgus. It does not correct even with going up on the toes. And that is something which happens when either the subtalar joint has got fixed or the tibialis posterior tendon has stopped working, or both of them. So you have to understand this concept quite clearly. So we'll go to what exactly is a posterior tibial tendon disorder, which was called initially. And then gradually the nomenclature changed and it was started being called adult acquired flat foot disorder, because it was understood that it was not just the posterior tibial tendon which was responsible for all of the pathology. So it was called adult acquired flat foot disorder, which is the most common denomination which is used now for this problem. However, in 2020, a group of very well-known foot and ankle surgeons from across the world got together and started calling this as a progressive collapsing foot deformity. And that's because basically said that it's not just a flat foot. It is a combination of a flat foot with other deformities in the foot. So it's called now PCFD, although still the nomenclature or normal nomenclature for this kind of deformity is adult acquired flat foot disorder, which is the AAFD. So now it is known that this is a complex 3-dimensional deformity with varying degrees of hindfoot valgus, a forefoot abduction, and midfoot varus. So forefoot is going to abduction. The medial arch has collapsed, which is called as the midfoot varus. The medial arch has collapsed. The talonavicular joint has gone into abduction, and the hindfoot has gone into valgus. So all of these contribute to the deformity. Now we know that there are 3 arches in the foot.